Canadians are justifiably concerned about the dedicated new health funding being presented to all of the provinces and territories by the Justin Trudeau Liberal federal government. Let's dig in. Concerns around digital ID run rampant in wake of things previously coined as conspiracy theory like COVID-19 vaccine passports and digital health passes. Concerned citizens say that it paves the way for a Chinese Communist Party style social credit score system. Such digitization could mean being able to turn off your financials, which apparently the government can already do, as evidenced by our Deputy Minister Chrystia Freeland's freezing of political dissidents' bank accounts during the trucker convoy last year.
As of today, a bank or other financial service provider will be able to immediately freeze or suspend an account without a court order. In doing so, they will be protected against civil liability for actions taken in good faith.
But nonetheless, worries abound that a digital ID could have the ability to remove your access to various sectors of civil society with essentially the flip of a switch. And that's already happened in Canada for months on end between provinces and territories with vaccine passports, and for the better part of a year federally with the No Arrive Can app. It's exactly why we have launched a petition and campaign at stopdigitalid.com. So if you would like to keep up with the reports on this particular topic, and then sign our petition and subscribe to our email updates at stopdigitalid.com. These concerns have been heightened in recent weeks as Canadian Prime Minister Justin Trudeau committed $196.1 billion over 10 years to provinces and territories for healthcare expenditures and improvements, right under the guise of convenience and safety. $25 billion worth of this funding will go to 4 areas of shared priority. This includes family health services, health workers and backlogs, mental health and substance abuse, and the one that has Canadians concerned about medical privacy, an ambiguously worded priority of a modernized health system. They're saying that the funding is to help accelerate progress. Canadians deserve to know what progress is being made. That is why, to access their share of the federal funding, including the 5% CHT or the Canadian Health Transfer, provincial and territorial governments are asked to commit to improving how health information is collected, shared, used, and reported to Canadians to promote greater transparency on results and to help manage public health emergencies, an Ottawa news release reads. The intent is to modernize the healthcare system with standardized health data and digital tools, according to a Government of Canada backgrounder notice. This includes $505 million over 5 years to the Canadian Institute for Health Information, or CIHI, to Canada Health Infoway, and federal data partners to work with provinces and territories on developing new health data indicators to support the creation of a Center of Excellence on health worker data to advance digital health tools and an interoperability roadmap, and to underpin efforts to use data to improve safety and quality of care. Many have expressed privacy concerns around digital identity initiatives like the one being currently implemented by the Ontario government. And while almost every premier has denounced the speculation that the funding increase will infringe on personal and private health information, like Saskatchewan Premier Scott Moe, Premier of Alberta Danielle Smith, and Ontario Premier Doug Ford. The thing is, the provinces and territories have always shared general health system data with the feds on a public health level, not personal private information. But as with all ambiguously worded legislation that is typical of this Liberal government, the way that this modernization is actually implemented on the ground is up for debate. And in addition to Ontario's digital ID program, Newfoundland and Labrador, for instance, already have a digital ID pilot project in the works. The last time the Trudeau Liberals dabbled in digital ID, it was the notoriously controversial and failed Arrive Can app, a digital surveillance tool that cost Canadian taxpayers $54 million and collected no data as to whether or not the app had a net benefit or stopped the spread of a seasonal respiratory virus.
It's good to know, but no surprise, that the Prime Minister thinks that $54 million is just a petty matter. According to one, a programmer demonstrated that the Arrive Can app could have been designed in a single weekend for less than $250,000. Instead, this Prime Minister paid $54 million. 10,000 people were sent by that app wrongly into quarantine when they shouldn't have been. Someone designed an app that didn't work, that sent 10,000 people wrongly into quarantine, that had addresses, home addresses, as the headquarters of the companies that received the money. Many of the subcontractors are still secret, and if the Prime Minister will not tell us the identity of those companies, then maybe he can tell us who was the genius. Would the genius who spent that $54 million on an app that could be designed in a weekend please stand up now?
The Right Honourable Prime Minister.
Adding to the litany of ethics breaches by this same government, the legality of the costly and useless app is being questioned and scrutinized by lawyers at the Democracy Fund as we speak. This government has been notorious for not only ethical breaches, but also privacy infringements after the Public Health Agency of Canada bought private Canadian cell phone data from telecommunications giant TELUS to track and monitor COVID restriction compliance.
The Public Health Agency of Canada confirmed media reports just before Christmas that it had secretly accessed location data for 33 million mobile devices to monitor the movement of Canadians during COVID-19. That number represents roughly 87% of the population who were spied on without any knowledge that the government was accessing their data. Public Health Agency of Canada officials were forced to admit this had occurred after a request for proposal was published with a call for interest in continuing a program of collecting data for up to 5 more years.
It would seem that in light of the COVID-19 pandemic and how digital health passes and vaccine passports were utilized to segregate the clean from the unclean, coerce medical autonomy in a direction that followed the masses, and otherwise ostracized those making different medical choices than the mob, it's fair to be concerned about this modernization of digital health tools and systems. Sign our petition to stay up to date and oppose digital ID at stopdigitalid.com. For Rebel News, I'm Tamara Ugolini. At stopdigitalid.com, you can sign our petition showing that you do not consent to the slippery slope enslavement of digital ID under the guise of modern convenience. There at that website, you can also stay up to date with the reports on this topic too, so make sure that you sign up and sign our petition at stopdigitalid.com.